with us today.
Well, thank you, Jonathan. And there's so much information that's come out. This was based on a groundbreaking study that was done here in San Diego by a physician who was running a preventative medicine program called, his name is Vincent Felitti. He's still around. He's a great person to talk with. He's a real interesting gentleman. And he found some concerns when he was talking with his patients. And so what he did was he worked with others to, at that time, and this is back in the late 90s, to put together a survey of folks to talk about what were things that happened with children early. And this was people remembering what happened. So we're talking about abuse, neglect, in factors like seeing your mother hurt or other kinds of things of someone being incarcerated, things that would impact children. And they were working on what they knew at the time. What Dr. Felitti found, and it's really groundbreaking, is that the more of these adverse childhood experiences you have, and his study included 10, and today I would say that there's more that we need to consider. Of those 10, the more you had of those experiences, the more impact there was to your health behaviors, your health risk-taking behaviors, but most importantly, what happened to your health. There was higher rates of heart disease, higher rates of cancer, higher rates of asthma, chronic lung conditions. So this is really a groundbreaking study that shows that early childhood experiences have lifelong impacts on our health and well-being. Now, that said, I don't want people to think, oh my gosh, I had these and it's my destiny. What we find is that if you have someone who's there and can help you in your relationships, there's ways to really bounce back and have resiliency. I know Christine will talk about that as we go through. But again, the importance is to remember that if you're triggered, and sometimes holidays can be a trigger, it's really important to look at those things and get help. And again, the help doesn't necessarily have to be mental health. It can be, but really supportive relationships are critical. And the way that I think about it is that the brain, the body, behavior, and relationships are all affected by what we call toxic stress. And there's three kinds of stress. There's a good stress. Remember when you're trying to learn how to drive a car, it's kind of stressful. Your feet, your hands, everything, you're like, I don't know what to do. Like today, it's so automatic. But when you started, there was stress. And so there's a good stress that helps us be more alert. Then there's something known as tolerable stress. And tolerable stress is that stress that you have that's temporary, and also that it's buffered by somebody who cares about you. And then the third one that we worry about is toxic stress. And the toxic stress is the stress that is unmitigated and you're not being supported. And that actually has impacts on our body, in our nervous system, our immunological system, and our hormonal system. So we have an understanding of how that works. So that's a very, very quick overview of a lot of material and a lot of research. But the important part to know is it's not what's wrong with you, it's what happened to you. And we do not look at people and think that there's something wrong with them. We think there's things that happened early in their development that still impact them. And trauma from early childhood is important, but trauma later in life is also important. And I think what we really can do is kind of destigmatize this idea of trauma, because when we're traumatized, we feel isolated. And being isolated is exactly what makes it stick. And we want it to become unstuck. And that's where relationships come in.